All right, so today we are finishing up the clinical part of what we're doing in this distance learning bit. I think it would have been the third day of week 3, the final day of week 3. It was supposed to be on Friday, but then we moved things around for Easter. So now this is Tuesday, although I'm giving it to you on Monday. So everything's kind of wonky, but here's the schedule that we have tentatively for the rest of the semester, depending on what time we get back. But if it keeps being distance learning the entire semester, this is what we'll do for now, subject to change a little bit. We just went through all of the clinical. This is today here, and we're going to finish up doing dissociative disorders, which is multiple personalities and the amnesias, as well as eating disorders. I'll try and move really quick through that. The whole thing's been really quick. And then we will have an open note quiz afterwards, which will be on Google Forms like usual, but it'll count as a quiz grade, but it'll be open note. Probably not curved, but since it's open note, it should hopefully help your quiz average. Then we'll spend 2 days on social, and then we'll go unit by unit through the remaining units to review for the AP test, and we'll do some review on FRQ specifically, since that's all that the AP test is going to be this year. And then we take the AP test, and we'll figure out the rest. Okay, so if you go to argenheimer.com, /clinical, you have all the handouts here. In fact, those would probably be useful for completing the quiz that you're going to take as well. But today we'll go over dissociative and eating disorders. The rest of them we've already done. And they are these two. So let's start with dissociative. So if you want to bring that up, let me move myself over a little bit here. All right. Ordinarily, we'd spend at least 2 full days on these two things. We're going to do it in half of a day. So, I'm going to try and go kind of quickly through this so you have time to take the quiz. By the way, I won't make the quiz due until... I'm giving this to you Monday, Tuesday. This ought to be due... try and have it done Tuesday night still by 9 p.m. If you have some circumstance that makes it difficult, it really shouldn't be bad. It's only like a 30-question quiz, and I'm going to take out the questions that we didn't talk about, so it shouldn't be that bad. So try and have it done by Tuesday at 9 p.m. or before. So anyway, dissociative disorders, the main dramatic one is called dissociative identity disorder. It used to be called multiple personality disorder, but apparently that made way too much sense because it was multiple personalities. They wanted to make it a little bit more confusing, so they named it dissociative identity disorder, and that is having multiple personalities. I talked about this in schizophrenia, but it's often misunderstood as schizophrenia. Schizophrenia is having hallucinations and delusions. It's a split in your mind is still kind of misleading, but DID is multiple personality disorder. There are, let me skip down to the cause. The cause of the disorder, let me skip down to controversy. Controversy of the disorder is... In the 1970s, there was a movie that came out, Sybil, I think. Movie. In 1976, there was a movie that came out, Sybil, with, what's her name? Sally Field? Apparently. Anyway, came out, and... It's a movie about a person that had multiple personalities. Before the movie came out, there were very, very few. It was an extremely rare thing to be diagnosed as. And then after it came out, the number of DID diagnoses increased by like 100-fold. And so that doesn't necessarily mean it's not real. It could be that people had it and then it just became more aware. But the controversy is that a lot of psychiatrists think it doesn't exist, or at least doesn't exist to the prevalence that it's being diagnosed now. It can be kind of exciting for a therapist to have someone with the ID, and we all have bits and pieces of a lot of mental disorders, but you don't have the disorder unless you have the disorder. But we all have anxiety, but we don't all have generalized anxiety disorder. We're all sad sometimes. We don't all have major depressive disorder. In the same way, of course, you act differently in school than you do at home, than you do on a Friday night with your friends, than you do in church. That doesn't mean you have dissociative identity disorder. Dissociative identity disorder is marked as an amnesia between your personalities. So there's some really good YouTube videos about people that have this, which it's a shame we won't all kind of skim through it and hopefully won't get blocked for that. But there's a girl and she has 7 personalities on YouTube. It's Helen. If you do a YouTube search for Helen, 7 personalities, you'll find it. It's like 40 minutes long. And she, some of her, in your personalities, you can know different things. You can actually know different languages. If you learned a language in one of your personalities, you can not know them. They did MRI scans where you can learn a list of words, and then they'll do things like eye trackers or something to see if you're familiar with a list of, so they'll, in personality A, they'll teach a person a list of words, they'll flip to personality B, and then show them the words, and it actually does seem from brain scans and different techniques that they are not familiar with that words that they learned in personality A. But if they flip back to personality A, they still know those words. So there's like a complete memory disconnect between these personalities, and they can have, I mean, there's a lot of kind of myth around this kind of thing as well, but supposedly they can have different, know different languages, different accents, different genders. It gets pretty out there. But the cause is severe childhood trauma. So if a person was severely abused as a child, then they can't deal with that abuse as the original person, which would be called the host. So they switch into a different person who's not abused, and then they can kind of get away from that in their alter identity, which is all the other things. It's sort of like if you've seen the very weird movie Never Ending Story. It's not a story about DID, but it kind of is. There's this kid, I forget his name, but this kid that he gets bullied in school, so he goes up into the attic and starts reading this story, and then he becomes, I don't even remember his name, but he becomes the hero of this story where he flies in magical lands and rides this creepy looking dragon and all that. But that's kind of like his host identity gets bullied, and then he switches into his alter, which does not get bullied and is a hero and all that. So that's kind of how that works. We'll play around well, why not do that now? Let's do that now. So let's see if I can get copyright ban. I haven't gotten copyright struck yet, so we'll see if I can pull that off today. Nope. Helen. 7 personalities. There it is. Okay. How do I want to do this? So there's this girl, she's 35, and she had, if you have time on your hands, it's an interesting documentary to watch. It's just the woman with 7 personalities here.
There I lost a chunk of time.
From this, in this case, she kind of has a blank, and this seems to be consistent with case studies, but she kind of has a blank stare for a little bit, and then she flips into her other personality. And often there can be triggers that coerce her to move into the personality. She says she hears voices in her head, and the voices will cause her to switch. But also some of her, and you can think this is fake, you can think it's real, it doesn't really matter. It's either fake or real, and what you think about it doesn't have any impact on that. But some of her personalities are little boys, and so they like to play with Legos and things. So if she's around Legos or stuffed animals, then that can be a trigger for her to switch into other personalities. But then you'll see some YouTube videos. We're not going to actually watch these, but I'll just show you what you hit here, where it's like person with hundreds of mother with 20 personalities. This one's pretty weird on Oprah. It gets very weird. Here we go. Woman with 2,500 personalities. I don't even know 2,500 people. Anyway, so it's a weird rabbit trail to go down if you want to go down that trail on YouTube, but that's dissociative identity disorder, having multiple personalities. Depersonalization disorder. We are at not quite 10 minutes. Depersonalization disorder is frequent out-of-body experiences. So that's you feel like you're floating outside of your body and you're watching yourself live your life. It's like, despite the fact that you're doing things, you feel like you have no control. You feel like you're a robot and you have no autonomy and you're watching yourself being controlled by somebody else, like a disconnect feeling. And if you have frequent episodes like that, then that would be depersonalization disorder. There are 4 types of amnesia. In fact, let's bring up the old paint. Great. Not sure if I'm going to like this or not, but retrograde amnesia, it already says it. Retrograde amnesia is, so I guess it was a waste of time to do paint. That's fine. Retrograde amnesia is forgetting events before an incident. Anterograde is after. So these 2 are directional amnesias. Retrograde is forgetting before, and antero is forgetting after. So if you're skiing and you hit your head and you forget your name, retrograde amnesia. Anterograde amnesia is if you hit your head skiing and you know everything, but then when people introduce themselves to you, you can't remember them. So anterograde amnesia is the inability to form new memories. Retrograde, you forget previously learned information. That's 2 directions of amnesia. These 2, localized and selective, are how prevalent the amnesia is and how spread out it is. But localized would be you forget one entire episode. So that's like something traumatic happens to you and you forget the entire, you're in war, in combat, and there's a particularly bad day and some of your friends died or something, and you forget that entire day. It's just totally gone. Localized amnesia. Selective amnesia would be forgetting bits and pieces. It's like it's fuzzy. If you like, oh, did that happen? I kind of remember that. Man, that would be selective amnesia. But if it's totally gone, localized. So retrograde amnesia, directional, and localized and selective are like how full is it. Dissociative fugue. Then we move on to eating disorders. Dissociative fugue is one of the weirdest disorders in the DSM. It is literally retrograde amnesia plus walking around. I probably should stop even talking about it because it's so rare. If any of you've seen Breaking Bad, not that I'm suggesting you should see Breaking Bad, but that's Walter White, who's the main character, and I'm not giving any spoilers, but he fakes an episode of dissociative fugue. So he shows up in a grocery store and pretends like he has no idea who he is or where he is to get away with some stuff. But that he was attempting to fake dissociative fugue. So that's like Ed McGuinness, one of the students, doesn't show up one day, and Miss Sokolowski calls the parents, and they say, well, he went to school. And then no one knows where he is, file missing persons report, all that. And then 2 days later, we find a person who's now working at like a Subway in Tuttle, Oklahoma, and they're going by the name Timmy. But it's so going by new name, don't remember anything, but they just moved and like recreated themselves. So I guess sort of like Jason Bourne, also from the Bourne movies. All right, so that's dissociative disorders. Let's go to eating disorders. If you can bring up that sheet, or just look at mine. Eating disorders. First of all, there's a 10-to-1 ratio of females to males in eating disorders, and if I was in class, I would ask you why, but there's a number of reasons. Some of them are, and we've gotten a little bit better about this, but especially maybe 20 years ago or so, it especially, the ideal woman was almost anorexically thin, and it's kind of had a pushback to that lately a little bit, but and the ideal man is big and strong, so that leads into some of it. So I don't know, there's probably lots of reasons why that is the case, but it is the case that there's about a 10-to-1 ratio of eating disorders in favor of females. Let's see, anorexia and bulimia are the 2 eating disorders that most people know of, and if we were in class, I would ask you, what's the difference between anorexia and bulimia? And every single time someone will halfway accurately say anorexia is the one where you don't eat and bulimia is the one where you throw up. And that is like kind of usually by symptom true, I guess, but it's not by definition true. Anorexia, the main difference between anorexia and bulimia is that in anorexia you're underweight. And actually I need to revise this and I haven't done it yet, but as of the DSM-4, it used to be that you had to be 15% underweight to qualify for anorexia. So if you Google a BMI chart, find out what your weight is supposed to be for your gender and height, and I guess age, and then subtract 15%, and that would be the threshold for anorexia. It's no longer the case. Now it's more subjectively underweight, but you have to be underweight with anorexia. But as of the DSM-4, it used to be a refusal, and the word refusal, by the way, is an important word. Like, for instance, when I was 16, I would have qualified for that, but I hated the fact that I would qualify for that. So I was a really tall, skinny kid when I was 16. I was probably 15% underweight, but I would have loved to have gained weight. And kind of bad to brag about that. I'm not bragging, I mean, whatever. But anyway, I was really skinny and I hated it. So by number, I would have qualified, but I would not have qualified by the refusal part. Let's see. You have an intense fear of gaining weight or becoming fat, even though underweight. That makes sense. Distorted perception of body shape and size. So even though you're underweight, you still might like intellectually know that you are below what the BMI chart says, but you'd still think, yes, but like I can still, there's still like some fat on my body, and I could stand to lose still another like pound, or I like where I'm at, or something like that. And then in women, an absence of at least 3 consecutive menstrual periods, because anorexia, as we'll talk about, is extremely damaging to your body, and it ends up messing up your period cycle, or lower testosterone levels in males. It's actually, where do I have this written here? It is the most lethal psychiatric disorder. About 1 in 8 people with anorexia will die as a direct result of anorexia, which is the most lethal. If you look at the entire list of disorders in the entire DSM, anorexia is the one you want the least of all of the disorders if the main thing you're looking at is risk of death as a direct result of the disorder, which is pretty crazy. But it's also, on top of being extremely dangerous from a death perspective, it's also very hard to come back from. And even if you go to like rehab type centers, the relapse rate's pretty high. So it's a really bad thing to have. You definitely don't want that. There are 2 types of anorexia: restricting, which is primarily when you would restrict the amount of calories you take into your body. And then it says binge purge, but it wouldn't, with anorexia, it wouldn't really be binge, it would be purging. So with anorexia, most people think anorexia is the one where you don't eat, bulimia is the one where you throw up. But with anorexia, you can still throw up to control your weight. Let's see. So even if you don't die, you can still have, it says irreversible brain atrophy, but there's also other physical issues that can be caused as well. Most common age of onset is 15 to 19, which is exactly what you all listening to this video are right now. So congratulations, especially the females listening right now. You are at the prime age to develop anorexia. Lifetime prevalence is 0.5%, 5 in 1,000, or more specifically to McGinnis, as 700-person school. If you think how many people at McGinnis either currently have or will develop anorexia, and statistically speaking, it should be 3.5. So 0.5% of 700 would be 3.5. So you think next time you're in mass or looking at the entire student body, just think 3.5 people statistically rate to have or will get anorexia. Side effects would be cold hands, difficulty dealing with cold, yellow skin, and all those have to do with poor circulation, dry or downy hair, brittle hair, nails, low blood pressure, feeling dizzy and weak. Let's move on to bulimia. Bulimia, the safe alternative to anorexia. I'm kidding, I guess I shouldn't. But yeah, no, it's not the safe alternative. It is less lethal, but there are a lot of problems with bulimia as well. And with bulimia, you cannot be underweight. In fact, there's some in the DSM, there are some conditions that kind of trump other conditions, and it's usually the ones that are more dangerous, that if you have both, it means you have the more dangerous one, and this is the case here. So if you have bulimia, and then your weight decreases to the dangerous 15% underweight threshold, then you would have anorexia. You would not have bulimia, despite the fact that you may be throwing up or purging in some way. So bulimia is cycles of binging, which binging is taking in more calories than you would normally consume in a meal, and then purging. So you eat way more food than you would ordinarily eat, and then purge it out. I'm not sure if you have to binge, but it involves usually cycles of binging and purging. You must be at least normal weight, and often over normal weight. So people with bulimia can, and probably usually are, slightly overweight. You have an intense fear of gaining weight, that makes sense. Usually, there we go. A lot of calories. For whatever reason, the age of onset for bulimia is older than anorexia, so it's 20 to 24 instead of the teen years. So 15 to 19 is the age for anorexia, and then I don't really have an explanation for that, but for whatever reason, the main primary age, the most common age for developing bulimia is 20 to 24. Lifetime prevalence, much more prevalent, is 1 to 3%. So let's call that 2%, and that would mean that at McGinnis, you would expect 14 people to eventually develop bulimia. Side effects of bulimia: calluses on hands, tooth decay, swollen salivary glands, which all have to do with throwing up. So if you forcibly cause yourself to throw up, by the way, the stomach acid in your stomach can be extremely damaging to your teeth when done regularly. So if you throw up infrequently, it's not that big of a deal, but if you throw up as frequently as you might with bulimia, then the enamel on your teeth, on the outside of your teeth, doesn't grow back. You get that once and that's it. And so having the acid touch your teeth so often, it can cause tooth decay. It also, going up in your throat regularly, greatly increases the risk of esophageal cancer, which is a particularly bad kind of cancer to get. So you don't want to throw up that regularly. But there are 3 types of purges, and I don't have that written here, do I? Interesting. 3 types of purges that qualify, and that is throwing up. You can take laxatives and have it go out the other end, as well as extreme exercise still counts as a purge. So if you binge by eating an enormous amount of whatever, and then you feel guilty, and then you go and run 10 miles, specifically to burn off the calories from that meal, that could qualify as a binge purge cycle. It can work a lot like any addiction, really, but like alcoholism. Someone with alcoholism might drink, feel bad about it, swear off drinking, be good for 2 days, and then get tempted, succumb to the temptation, drink, and then say, I'm so bad, I'm never ever gonna, that kind of, just the cycle over and over of drinking. And the same kind of thing with bulimia. So you'd say, I'm gonna eat healthy, or not healthy like carrots, but healthy like I'm not gonna binge. But then you get tempted, you eat a lot, you feel terrible, and then you throw up to fix it, and then it's just this like extremely unhealthy cycle that would be bulimia. EDNOS, the NOS criteria, is a criteria on a lot of families of disorders. It stands for not otherwise specified, NOS. And that is, schizophrenia has one too, schizophrenia NOS. And that is, it's like eating disorder, but you don't quite qualify for any of the other eating. It's like miscellaneous eating disorder, not otherwise specified. So maybe if you are, you have what would be anorexia, but you're only 5% underweight, so you're slightly less than you should be, not 15%. You throw up sometimes, but not enough for bulimia, then you could get EDNOS. It's like the catch-all for it doesn't quite qualify. It doesn't match anything specifically. And then binge eating disorder, and that is just binging, no purging. And it's interesting that this is, the age of onset for this is 30 to 50. It's like the midlife crisis disorder, I guess. I don't know. But that's where you eat in binges, but you do not purge. And that would lead to extreme obesity. So that's it. We have completed the everything. So I will, I'm actually going to go right now and I'm going to modify the test, the quiz, and it'll probably end up being something like 20 questions. There's a number of, in fact, I'll show you the quiz right now before I've modified it. Oh, that's not the quiz. Where is the quiz? It's on my desktop. Bum, 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 bum. No, it's not. I don't know where I went. Anyway, I'm going to work on that right now, and I'll remove the questions that we haven't gone over. And there's going to be a Google form with A, B, C, D, E options. Just fill out the options, and that'll be it. So I'll see you next time. Next time we'll talk about social psychology. That's it. So hope you all had a good Easter, and I will see you next time.